So I just wanted to, again, go back to why this is important to the Pan American Health Organization, to our Institute of Medicine, and to our National Institute of Environmental Health Sciences. And the underlying reason is that a very significant proportion of disease and suffering throughout the world is related to modifiable environmental factors. And this is a slide showing the results of an analysis that was really based about 10 years ago by the World Health Organization that demonstrated that overall across the world, about 24% of all disability-adjusted life years lost, or this measure of both disability and death, was related to environmental factors. And these could range from the biological environment, like water pollution. They range to the chemical environment, like air pollution, but also man's built environment, and especially things like road safety, road traffic accidents, as well as opportunities for physical activity. The slide shows you that the burden of disease related to the environment is highest actually in the poorest countries of the world, which is one of the reasons why this is also so intimately linked to sustainable development. Because as we focus our attentions on developing and bringing a better economic life to people in the poorest parts of the world, this is also where we have, in many ways, the greatest opportunities to simultaneously improve health by doing this sustainable development in a way that's informed by the environmental health considerations. And that's really why we're here today. This slide shows, it's a little bit busy and I apologize, but this is, and because we're going short on time, I'll go very quickly, but this was an analysis looking at specific causes of death and disease that were related to the environment. There's a deep green bar and attached to a light green bar. The total size of the bar shows you the total burden of disease associated with that factor, and the dark green bar shows you the extent to which that total burden is related to environmental factors that can be modified. And what you can see in the red boxes are all of the diseases that we typically associate with the poorest countries in the world in an environmental disease, related to water contamination, related to communicable diseases. One of the things that I want to impress as we start off is that environmental illness in a setting of development has focused a lot on water and sanitation. It's focused a lot on household fuels and infant mortality from pneumonia, from infectious diseases. But as we go through this global transition from communicable diseases being the greatest cause of death and suffering to non-communicable diseases, I'm going to make the point that a lot of non-communicable diseases also have environmental origins and can be modified by environmental interventions. So next slide, please. This is just one cross-section of the kind of research that we do at NIEHS that helps to provide information to inform sustainable development. And you can see the top is the work that we do on indoor air pollution and cook stoves, which relates to childhood diseases and in particular infectious pneumonia. We also do a large amount of work that informs non-communicable disease prevention, ranging from work on air pollution, on endocrine disruptors, and also on climate change impacts from heat and air pollution and pollen effects. Next slide, please. One of the key goals of sustainable development is to bring energy, to bring transportation services, other economic services to people who don't have them in a way that doesn't compromise future generations. And one of the greatest ways we know that is being compromised is by extensive dependence on fossil fuels, increasing greenhouse gases, and climate change, which we're already experiencing. As we look to the sustainable development goals and try to inform development, economic development efforts around the world, one of the key points that we need to make is that there are substantial health benefits that can be obtained from certain climate mitigation and sustainable development policies. And this is a set of studies that appeared in The Lancet 3 years ago that NIEHS was proud to co-sponsor, and it demonstrated that there were actually significant economic benefits related to these health benefits that were to be had from sustainable policies in transportation, in agriculture, in food consumption, in household energy, and in large-scale energy production, and that in many cases the economic benefits would significantly offset the costs of any of these sustainable development policies. Next slide, please. And so we believe there is this very important nexus between environmental health and sustainable development. NIEHS is proud to partner with the World Health Organization last May to convene a group of experts to discuss some specific ideas for indicators that could be part of the discussion of sustainable development goals and indicators in other sectors. One of the key points, and we'll be coming back to this throughout the day today, is that in order to achieve the health benefits from some of these environmental health problems, the cards are not held by the health sector. It's not the health ministry that's going to change urban planning or transportation systems. It's not the health ministry that's going to direct energy policy. And so we need to be working in an intersectoral way to be raising awareness within these other sectors of the health implications and recognize that it's the other sectors that have a very, very strong hold on the health of future generations. And so this was one effort to get that discussion going. And of course, this webinar series starting today is the ongoing effort now after the Rio Summit to continue this discussion and to try to create these interlinked awareness. So next slide, please. Just some basic ideas as we get into this, some ideas that came from the discussions that we had in Geneva about indicators, about how do we create synergism within the SDGs? How do we offer information and offer awareness of the health implications in a way that really improves the system and doesn't bog it down? And here are just some of these principles, and I put with it a picture of silos. If I had a picture of silos blowing up or being torn down, I would have put that picture in. But we have to tear down the silos. We have to start with those areas that have the greatest public health importance. I started with the slides from the 2004 Global Burden of Disease. The next version of the Global Burden of Disease will be coming out in December. That will be a very key document and set of information to start basing our priorities on, looking at what are the highest attributable burden and then the greatest public health significance. We have to start where we have the greatest scientific rigor, where we have the greatest understanding of the cause and effect between exposures and disease. One of those areas will be air pollution, certainly, indoor and outdoor air pollution. And we need to build up the science base for some of the other areas that we'll be talking about. It has to make economic sense. The costs of the intervention have to be reasonable. The benefits that we get from it have to be figured out and to be sizable in order for this to be widely accepted in other sectors. We have to be able to speak the language of other sectors. And lastly, I say this a little bit tongue-in-cheek because this is complicated stuff, and tearing down silos and linking things together is always complicated. But as we try to translate this into the SDG process, the Sustainable Development Goal process and indicators, we have to always be striving for simplicity. Simplicity in the articulation of the goals, in the way that we communicate these interlinkages, and simplicity in the types of indicators that we create so that we aren't setting an impossible goal in terms of collecting the data and being able to track and monitor progress. So with that, let me close. Next slide, please. And I just want to point people to a commentary that has been released today. I had the pleasure of writing this with Dr. Judy Wasserheit of the University of Washington, who right now is co-leading this innovation collaborative. And this provides, again, not the answers. We're just starting the discussion. But this is a little bit more of a richer discussion of these issues of how do we achieve synergy, how do we start breaking down the silos, how do we improve health by linking ourselves with sustainable development in other sectors. So with that, I'll close and move on to the next item on our agenda, which is a great pleasure and honor for me to be able to introduce Dr. Maria Neira. Dr. Neira is the Director of the Department of Public Health and Environment at the World Health Organization in Geneva and has been a wonderful partner in these activities that I've been describing. She's held past positions as the President of the Spanish Food Safety Agency and Vice Minister of Health and Consumer Affairs in Spain. Dr. Neira was also appointed in 1999 as Director of the Department of Control, Prevention, and Eradication at the World Health Organization. And we're very delighted to have her with us, again, virtually on the phone and to hear from her on this topic. Dr. Neira?
Yes, good morning, good afternoon. Thank you very much, John, for the nice introduction. I'm very happy to be here with you, hoping that you can hear me, and a pleasure to be talking.
Dr. Neira, you can go ahead with your presentation.
Sorry? Can you hear me?
Yeah, I can hear you.
Okay. Sorry, I have been interrupted. Yes, I'm starting my presentation, and I was saying that this is really a pleasure to be here with you discussing on how we can all together make sure that we position health in what is called the post-2015 development agenda. I'm sure you all know this document called Realizing the Future We Want for All, the report to the Secretary General. I don't need to tell you the importance of working on a kind of circle, maintaining the environmental sustainability, peace and security, inclusive social development, inclusive economic development, and then with at the center as an important and sustainability. Can I have the next one, please? Since we are talking about how to position health in the agenda, I think it's extremely important to spend a little time, although it's not very pleasant to talk about process, it's extremely important to know a little bit the process, and particularly the architecture that has been created under the Secretary General special panel on the post-2015 development agenda. I'm sure you know that there is a high-level panel. The mandate is on looking at what will be the post-2015 MDGs or SDGs or the development goals. And the output is that the Secretary General needs to deliver a report to the United Nations General Assembly by the second quarter of 2013. And they won't work based on a report of UN System Task Team. And this work will be informed by the Rio Plus 20 and the UNDG's consultations. There are three co-chairs that I'm sure you all know about it, David Cameron, Prime Minister of the UK, the President of Liberia, and the President of Indonesia, plus the 30 countries that will be assisting in this process. I think it's to be aware of that, give us the structure and how, to which we need to work and to which we need to influence and make sure that health will be part of the whole process. Next one, please. Next one, please.
Hold on.
Thank you. Okay. As you know, there are at the moment 11 thematic issues for discussion, and there are lead UN agencies that have been appointed. There will be process events and to support that consultation. But the one I would like to focus on is the health one, where, as you can see, the lead UN agencies are the World Health Organization and UNICEF. And there are two countries that will be playing a fundamental role, Sweden and Botswana. And in terms of the events that will take us to that, the conclusion of the consultations, there will be a global consultation to be handled in January or February 2013 in Botswana. Next one, please. Can I have the next one, please? Next one, please. Okay, thank you. Okay, this is a quite complicated map, but forget about that. I mean, it's just to have an idea of how the architecture can be complicated, and of course to bring to your attention the fact that there will be a lot of competition among different themes and proposed goals. And as you can see at the moment, there are 11 thematic consultations. One of them is on health, but I think the key point here is that obviously we will be working very much on the health thematic consultation. Okay. But
I'm being asked to just have you speak a little bit louder.
Oh. Can you hear me better now? Hello?
I've been hearing you well, perfectly well.
Okay. John, is that okay? Can you hear me now?
I can hear you very well here in Uganda.
Okay, thank you. So I will continue with my presentation. So I was saying that among the 11 thematic consultations, not only we need to be present on the health one, for which we have the leadership, but we need to make sure that we use the other thematic areas, the one like water or energy, for instance, to give you two examples, to include health as an indicator of the progress made in all of those sectorial policies. I think this will be fundamental for achieving what we would like to achieve. WHO has started the work on the health thematic consultation, recognizing that we need to be aware that there will be a very highly competitive environment. We need to make sure that the achievements made until now on the sustained gains and the investments that have been done until now towards the MDGs needs to be maintained. We need to be aware as well of the changing agenda for global health. We recognize that although until now there has been major progress, now the health-related MDGs, there is now a greater recognition of the need to focus on means as well as ends. And let me give you an example. We need to recognize health as a human right. We need to talk about how to enhance health security, or we need a stronger and more resilient health system, more innovation and efficiency as a response to financial constraints, or the very important one, addressing the economic, social, and the environmental determinants of health. And therefore, for us, a multi-sectorial response, those responses, we see health as an outcome of their policies. Therefore, in order to move in this very competitive environment, instead of looking for what could be the new health goals, we propose to build a case that health is a concern to all people and is influenced by and as well contributing to policies across a wide range of sectors. Therefore, we would like to see now a kind of overarching goal, and this overarching goal that we are proposing, can I have the next one, please? The overarching goal that we are offering in order to accommodate and to maintain the visibility of other internationally agreed health goals will be the universal health coverage. And the way we see this universal health coverage is proposing a goal of moving towards a universal health coverage, ensuring that the population is covered and ensuring the financial protection that is needed in order to have that. We think that this will be a kind of practical expression of the concern that we have for health equity and the right to health, and this will ensure, as you can see in the definition of universal health coverage, that all people will have access to the needed services, intending by the needed services prevention, promotion of health, and the services as well as the financial protection that is needed in order to achieve this universal coverage. So coverage with health services and with financial risk protection for all. That will be the formal definition that we will be working on it. Next one, please. Well, it's okay. Even if I don't have the last one, what I wanted to tell you that this is the umbrella overarching goal we are proposing, but as important as that will be to make sure that health will be part of many of the proposed thematic consultations that will take care. Let me give you an example. If there is a thematic consultation on water, WHO is already working with the UN Water and the Secretary General Advisory Group on Water and Sanitation on making sure that we frame water health related goals, and we propose to use health as a way to measure the progress that the sector on water and sanitation is making, and making sure that those goals will have a very clear and positive impact on the health of the people. Similar for energy, we would like to propose use health as an indicator of the achievements and progress made on good energy policies. And I think this is something that will be very much accepted by the population, and they will see better the outcomes, and they will support that. There will be much more popular support for those policies than have more diffuse or deferred outcomes, such as if we talk about reducing CO2 emissions. I'm sure that people will understand much better. And I think I will stop there saying that obviously this is a process, working process. We have some papers for consultations, but we are very much looking at receiving input and comments, and we are initiating our consultations in order to be able to, at the end of the process, be happy with the results of positioning health in this so complicated post-2015 development agenda. Thank you very much for your attention.
Thank you. Thank you. Hello? 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 Hello?
At this point, we're pleased to move on to the next part of our agenda, which is our panel. We have a panel of speakers who will provide their unique perspectives on what they have learned from the MDGs and the lessons learned for all of us, and insights on how we can position environmental health in the post-2015 process. What I want to do is introduce everybody up front, and I'm going to ask that we hold all online questions until we've been able to hear from each of the speakers. At that point, we'll have a time for a good, robust discussion, and I'm looking forward to that. To the speakers, I just want to let them know, and everybody on the webinar should know that everybody's virtual. None of the speakers are here in the room with me, so I can't do hand waving and eye contact to keep them on time. So I will be a verbal timekeeper, and as we move along, if we need to come to a close of any particular presentation in order to stay on time, I'll have to be cutting in and letting you know. With that, let me introduce our speakers. Our first speaker is Dr. David Serwadda, who is Professor of Disease Control and Environmental Health and the former Dean of Makerere University School of Public Health in Uganda. Dr. Serwadda is an infectious disease epidemiologist who in the early 1980s was one of the first physicians in Uganda to recognize the new disease that, of course, became known as AIDS. Dr. Serwadda is a member of the Institute of Medicine and a founding member of the Accordia Global Health Foundation's Academic Alliance. Our second speaker will be Dr. Paulo Bus. Dr. Bus is the president of the Oswaldo Cruz Foundation, or Theo Cruz of Brazil, from 2001 to 2008, and he's currently Brazil's representative on the World Health Organization Executive Board. He served as the president of the World Federation of Public Health Associations and has played a major role in public health both in his home country and around the world. Since the early 1980s, Dr. Bus has been a key figure in Brazil's rapid improvements in public health. And last but not least, Zehra Aydin is a senior program officer with the United Nations Environment Program, where she serves as the UNEP liaison to the UN Development Group, obviously very key to this topic today. Prior to joining UNEP, she was the UN Department for Economic and Social Affairs, or DESA, where she worked in the Division for Sustainable Development, managing the relationship of the Commission on Sustainable Development with civil society and the private sector. So welcome to each of our distinguished panelists. And again, I'm just going to remind the online audience to hold questions until all speakers have completed their presentations. Each one will have 10 minutes, and we'll start with Dr. Serwadda.
Thank you very much for inviting me to make my presentation on this very important topic. I really appreciate the opportunity. Hope my first slide is up. I'll quickly move on to my next slide. In my next slide, I'd like to make the point that the M.D.Ch.B, which is specifically expresses itself on environmental health, is linked to many other MDGs outcomes, ranging from natural resource management, protecting the quality of the regional and global health. Oh God, there's an echo there. Are you still with me? Hello?
Yes, yes, yes.
Okay. Sorry, I had a big echo there. But my point I'm trying to make in this slide is that the MDG7 is very closely related to outcomes of other MDGs. When you look at this slide, which I've borrowed generously from UNDP, it specifically looks at the various MDGs to which there is interconnections to the MDGs, ranging from MDG 1 to 3, 4, an outcome. Often, people tend to associate, as John pointed out, MDGs for access of safe water to many of the health outcomes, but there are so many other outcomes related to management of the environment that actually impacts on the other MDGs. So my point is that most of these MDGs are actually interrelated. And this brings me very quickly to what I think is the next challenge. Unfortunately, interesting, when I was a medical student about 30 years ago, during that time we were looking at health for all by 2000. And when 2000 came, we actually looked at why we didn't achieve some of these. There were many reasons, but sadly, as we are coming towards the MDGs towards 2015, one of the reasons that is still prevalent, that was there, is still the problem of the fact that MDGs are currently implemented as independent outcomes. But yet the process of achieving them is actually quite interrelated. John actually did point out earlier on in his presentation the issues of silos. You see, MDGs are implemented in silos while we don't have a very good systematic coordinated country platform of implementing them. So you may find that issues related with, and I'll elaborate this a little bit more. The other issue, which I'm going to elaborate a little bit more, was actually in our part of the world, really, the failure to take into account the dramatic population growth that is witnessed in Africa on the impact on the environment and MDGs and other MDGs. I'm going to specifically focus on this. I mean, there has been a lot learned about lessons of MDGs, and there's quite a long list of things that have been quite written about and discussed. There's been a lot of Lancet series on the MDGs and so forth. But I would like to sort of concentrate on those two issues, as I think in my part of the world have been extremely, I think, very important in terms of impacting on our MDG success. Now, let me specifically, next slide, look at the slide that looks at MDG coordination. So water and sanitation has a very important impact on health. As John has looked out shown in some of his slides, they do quite, MDGs has an impact on health outcomes. In my country and many countries in Africa, you find water and sanitation is actually run into Ministry of Health. The Ministry of Health can identify that these huge growing slums have problems of water and sanitation, and that is where we are having most of our diarrheal diseases. That is where we have very high morbidity and mortality related to childhood. But Ministry in order to supply water and sanitation in these particular areas is completely in another ministry. So this issue of really looking at outcomes, but not looking at the process of how we get into the outcomes. Because by looking at the process of how we get to the outcomes of these MDGs, one will quickly realize that most of the impacts, particularly in the health sector, for example, or for that matter in the education sector, are actually found elsewhere. And that is where I think this is a huge problem that we need to think about the process as we move into the post-2015. The other issue that I felt that was extremely very pertinent is coming to my next slide, is the challenges in African population growth. The most populous, by 2050, Africa is actually going to be the most populous country, a continent in the world. For example, the fertility rate in my own country is about 7 children per woman. This is a huge driver on the impact of the population. This is extending to deforestation, it extends into the need for fire, it extends the need for housing and rapid growth of slums. It moves into slums with poor provision of water and sanitation. So it's a huge driver that we really need to think about in terms of how to manage this on its significant impact on the environment and also onto the other health outcome. And I think this is something that is one of the things. Not only has it been a very important factor in making those impacts, but also when you say we're going to reduce HIV by 50%, but that denominator is really increasing all the time. So you're a little bit it has implications on the resources that you need to move forward. I think these 2 points have been extremely very important in trying to realize growth. The MDGs talk about reproductive health, but they do not specifically talk about this specific challenge. And I think post-2015, as far as Africa is concerned, this is going to be a huge issue that we need to look at moving ahead. So really in summary, because I've really concentrated on those 2 points, I think moving ahead, a country framework that builds, adds, and supplements each MDG goal in a coordinated manner is needed, with a view that some MDGs, particularly like those of health, are significantly actually impacted by other factors outside the health sector. And this population growth is a huge driver that will really have a significant impact in our part of the world that directly and indirectly affects the MDGs. Needs to be comprehensively addressed really moving forward, because I think this is a huge factor that not only will underpin in terms of the resources that needs, but also it's really going to create a vicious cycle in terms of being able to meet any targets that we talk about. I'm sorry I've been a little bit brief, but I think this gives us a chance to really catch up on time. So John?
Dr. Serwadda, thank you very much for this comment. Thank you very much for as a timekeeper. That was great. You've provided a lot of very interesting and provocative statements that I'm looking forward to coming back to during our discussion. But for right now, we'll move on, and we'll move on to Dr. Booth. So are you on the line?
Dr. Bruce, are you still on the line?
Hello.
Hello, now we can hear you. Dr. Bruce?
I don't hear anything. I don't hear anybody.
You may need to unmute your line. Dr. Bruce? Okay, well, let's see if Zehra is on the line.
Hi, I'm here.
Okay, we'll just go a little out of order.
it would have been good to hear what Dr. Booth has to say so that I don't repeat.
Well, I think you'll still be okay. But I'll let the moderator take over with getting your presentation underway, and we'll try to connect Dr. Booth for the final presentation.
All right.
So, Ms. Aydin, you have the floor. We'll very happy to hear your presentation, and we'll work through any duplication with Dr. Booth when he gets on.
Okay. All right. Thank you very much for inviting me to contribute to this process. I was asked to talk about the post-2015 development agenda process within the UN, and also a little bit on the MDGs and M.Ch.B, but not going too much into the details, and to squeeze all of this information in 10 minutes or less. I wanted to also talk about the process as a way to indicate entry points for contributions from your community. Next slide, please.
And Zehra, could I ask you just to speak up a little bit? We're kind of watching the monitors here, and if you can speak up a little bit, we'll be able to hear you better.
Okay. I'm starting with a list of current MDGs, not because people don't know what they are, but as an opportunity for me to say that they were not adopted by governments at the time, but they were implied by the Millennium Declaration that the governments had adopted back in 2000. If you haven't read the declaration or haven't read it in a while, it would be good to look through it, because it inspires ideas on our common responsibilities for today and for future generations. Out of these 8 goals, I will give you one slide, the next slide please, on MDG 7. And again, I wanted to mention that the section on which this goal was based is the protecting the environment section, and the 4 targets and the indicators do not necessarily match what the intention and content that the declaration gave. For example, there's a higher emphasis in the declaration on climate change, which doesn't appear anywhere in the Goal 7 framework. Under the indicators, the reason for different colors for some of the indicators is to show that of the 10 indicators, we have achieved only 2, and those are the ones that are underlined. The other 2 that are in green but not underlined is found to be on track, according to a report we wrote back in 2009. That may or may not be holding as true today, because back in 2009 the world was not in such a deep recession. But as you can see, less than half of the indicators for Goal 7 are achieved or on track. Now, we are 3 years away from the deadline of MDGs. So we have been looking at what we have learned from the MDG experience. Next slide, please. Some of the lessons, the positive lessons, are two that are most important, is that to have few goals focused everybody's attention. And that was a relief in a way, because at the point of the Millennium Summit, the world community was facing thousands of targets and goals coming from numerous intergovernmental meetings and conferences that happened in the 1990s. So focusing the attention was welcomed by a lot of people. And the MDGs also shifted the attention of policymakers from strictly looking at economic growth as development to thinking of economy, society, and environment together in a sustainable development manner. But some of the lessons, the positive lessons, also contain in themselves some negative lessons learned. Next slide, please. As you can see, when you have fewer targets or goals, it reduces the importance of many other internationally agreed goals and leaves out, necessarily, it leaves out a number of important issues, such as human rights, unemployment, peace and security, a major issue that affects all of the MDGs. And also, as I hinted at before in presenting the MDG 7 indicators and targets, not all of the goals have well-defined targets or well-defined, well-selected indicators. So that's a major lesson that we have to deal with in the next process. And that next process, as you've heard before, is the post-2015 development agenda. It has basically, I'm sorry, there's interference, there's some sound. Should I continue?
Yes, you should continue.
Yeah, I can hear you very well.
Okay. The post-2015 development agenda basically has three elements. The next slide, please.
I'm sorry, I'm just going to interrupt really quick. I think one of our speakers needs to mute their phone line. So if all the speakers can mute their phone lines right now and also turn off the audio on their computers. Okay, go ahead and continue.
Okay, as I said, the post-2015 development agenda process has three elements. One, it is expected to build on the existing MDGs because, as I mentioned under MDG 7, not all of the targets of these goals have been achieved, and we must make an effort to achieve them. So the existing MDGs have to stay, but we need to build on them. The second element is the opportunity this post-2015 process gives us to improve the content of existing MDGs. For example, the outcome of the upcoming 2.5 years of consultation could be that MDG 7 would have better targets and better indicators. And the third element is that this is also an opportunity for us to identify new goals as a global community because there are emerging challenges such as inequality, a major issue throughout the world, and equity gaps in both the developed and developing country sides. So finding new goals would be the element. Now, moving into the UN process, this slide, next slide, please. I will show a few slides just to show what the approach on our side involves. The first one is something that Dr. Neira had mentioned already in her presentation. We have been asked as the UN system to write a report, and this picture is the approach that this report proposes. In this report, we did not suggest specific goals or targets because we didn't want to create a shopping list. And we are fully aware that the final decision is up to the member states. But we made suggestions on three fundamental principles: equality, sustainability, and human rights. And we proposed that 4 elements should be the basic building blocks of the framework for the next development agenda. And for each of the building blocks, we also mentioned enablers or factors that would make or break the achievement of these areas. And we proposed them as markers for the discussion, intergovernmental discussion that's coming up. Next slide, please. Going further into the approach, the UN system report has been finalized. We are now in the second phase of the UN Development Group contribution, which is in 2 manners. One, national consultations that will take place in up to 100 countries, and global thematic consultations, and the list of that was already presented to you on 11 specific themes. I will explain a little bit more on these 2 processes from a contribution of the UN Development Group. But before going to the next slide, I wanted to also mention that once these contributions are completed, the process goes into the intergovernmental stage, starting from June 2013 through the end of 2015. There will be discussions to produce a globally agreed new development agenda, which would take effect in 2016. Next slide, please. Now, this slide shows you the initial list of countries where national consultations will happen. We are supporting it from headquarters as much as we can. The process of each national consultation is being organized in collaboration, through this collaboration between the UN Resident Coordinator's Office and the national government. I wanted to show you this list of countries because I've learned that your organization, your network, includes many other national academies of science, and it would be this list gives you an entry point, because if your counterparts in these countries could be mobilized to contribute to the national discussion, it would make a difference in terms of the scientific basis of that consultation. So this is the first entry point I wanted to mention, that if you can mobilize your networks of other national academies of science, that would be a great contribution. Next slide, please. Now, this is the global thematic consultations list, which you've seen also before. In the development group, all of us agency representatives, we agreed that the themes will have, all of the global thematic consultations will have cross-cutting issues throughout, and those issues are human rights and gender equality. But we also agreed that we will make an extra effort to find linkages and to encourage linkages between the themes, because it would not make sense to talk about environmental sustainability without discussing also education or health or food security or population dynamics. So there's already a decision within the UN Development Group that the global thematic consultations will not be themes in their little boxes and silos, but in their relationship with each other. I will talk a little bit about the formats that these consultations are following, because that was in the information that you heard already. Most of them follow the same kind of format. They start with, and I'm doing this because there's a second entry point to mention. They all start with a call for papers. Then they have a certain number of weeks or months in a virtual conversation that's inclusive and participatory. Then there's a kind of an expert or leadership meeting, and then out comes the final report that synthesizes all those findings. Now, in the environmental sustainability consultations, we are, which UNEP and UN Development Program are co-leading, we are taking a slightly different approach, mostly because there's so much work since the Rio conference in 1992 on environmental sustainability that not taking a different approach would have been a missed opportunity. So we also start with a call for papers. We expect to release that call at the end of this month or early next month. And we have our leadership meeting earlier. And that meeting does not prepare the final report, but instead it synthesizes some critical questions, which we will then put into the public sphere through social media and virtual spaces, and we will take a public poll. And we will try to understand where the public wants the environmental priorities to be. And the final report on environmental sustainability will be a description of the priorities that the public at large in all countries said they want in the future they want. And the opportunity for your organizations, especially again the National Academies of Science, is clearly there's an opportunity to contribute at the call for paper stage. We can provide you the information as the calls for papers for different teams are made. And then, of course, to be engaged and mobilize your networks, colleagues in different parts of the world, because we want balanced participation from all parts of the world, to enter into the virtual consultation and to be part of this public poll of opinion collection. So that's the second entry point. Last slide, please.
And I'm sorry to interrupt such an excellent presentation, but we do need to wrap up in the next minute or so.
This is my final message. That, I hope we can work together, and I hope you are convinced that you want to mobilize the National Academies of Science, other entities that are in your networks, as well as your membership to contribute to this process. Thank you.
Thank you very much. That was an excellent, very well organized presentation and very helpful for our discussions. At this point, we'll turn it over to Dr. Booth and ask for his presentation, and after his presentation, we'll be able to open up for general discussion.
Hello? Yep.
Yes, we can hear you fine. Go ahead.
Okay. Good morning for everyone. It's a pleasure for me to participate of this webinar session, and congrats for the former presentations. I think there are no many things to add to this excellent presentation before, but well, it's my role now, and I will try to present my contribution. And the next slide, please. First slide.
Dr. Bruce, I'm just going to ask you to speak up a little bit.
The premises that sustain this presentation are, one, that the healthy populations are crucial for sustainable development, or said differently, that there is no development without health. And the second is that health is fundamental for the full development of people's potential. And the skill that health is deeply conditioned by the mode of production and consumption, and by social, economic, and environmental determinants, which can be acted upon integratedly and intersectorally. Therefore, in order for us to develop sustainably, which is crucial for our survival and the survival of the planet, we need to reevaluate our current modes of production and consumption, and address effectively the social, economic, and environmental determinants of health. And this is not easy, but it's important. In the final document, let me remind now some key political statements. I think it's very important. Just a minute. Are you reading me? Yeah, I can hear you. Yes?
Yes, please continue, Dr. Booth, and continue to speak as loud as you can.
Hello? Oh.
Dr. Booth, are you still online? I think we might have just lost him.
Yeah.
So at this point, I think his presentation will be available online after the webinar for everyone to reference. But I think it makes sense at this point in the agenda to go ahead and turn to the discussion session. So I'm going to turn this back over to the moderator, John Balbus, to lead the discussion now.
Great, thank you, Erin. At this point, we will open up to discussion, and we are very fortunate to have some additional panelists. In addition to members of the Planning Committee who I acknowledged in the introduction, We have also invited 2 additional guests, William Sontag from the Office of International and Tribal Affairs of the USDPA, and Fatoumata Ketewane from UNEP, from the Chief Scientific Assessment Branch of the Division of Early Warning and Assessment. What we'll do is open up to questions and invite our panel of speakers to give their responses first, and then we'll invite our additional discussants to give their perspectives after we have turned to the speakers. So at this point, do we have a first question? Okay. I think we do not yet have a question from our audience. There were a number of interesting process issues that came up. Ms. Aydin raised the idea of points of entry into the process and the role of the national academies getting involved at the country level. And Dr. Serwadda, in his talk, also mentioned this idea of achieving this breakdown of silos, not so much from the very top down at the UN 192 country level, but I heard him say that each country needs a framework. And I think this makes sense, that it may need to work within the context of each individual's country, culture, and government structure to be able to work in an intersectoral way. So let me open it up to the speakers to give some additional ideas on how we operationalize this at a country level.
So, John, I'll be fast. I apologize, I may have to go very quickly. I think what happened is that, in my view, that most of these MDJs were really at a 10,000 feet level, or 10,000 meters. So what needed was that we really needed to domesticate the, so to speak, the MDJs at the country level. Mary did point out that actually the adoption of these MDJs were more or less, something that was agreed on in New York rather than having a bottom-up. So what happened is that these MDJs, or the process or the indicators, should have come down to the country level and have a very unpacked and figuring out exactly how this should be implemented and whether the goals were realistic. I think that process of really having a very rigorous country discussion really was not there. And that is something that I think when I hear the presentation given before is probably trying to attempt to rectify this time around, having it a bottom-up, in which case the discussions would really have started down from the country moving up consultation-wise. I think that way there's more dialogue and also more awareness of what it would take to really implement this. And probably there would be much more thinking about the process of how to get to these outcomes.
Thank you very much, Dr. Serwadda, and I know that your time is short. I appreciate your staying on as long as you can. And Zehra, did you want to add to that?
I was also very intrigued by the suggestion that there should be a country framework in every country, and I remember that there is actually, there has been an effort in that direction, and perhaps that could be built upon in the next round. After Rio 1992, there was a decision that the countries would develop their sustainable development frameworks, let's say. Some called it the National Agenda 21, for example. And quite a few countries did it, actually. And then the attention got distracted went elsewhere. For the new development agenda, it's probably going to include not only the 3 pillars of sustainable development, but also the other part of global communities' concerns, which is peace and security. And For that, the existing country framework, that whatever they may be called, National Agenda 21s, National Council for Sustainable Development, whatever it is, they could be perhaps revised, and the new agenda with that additional dimension that really completes the cycle. Because it would have been good if we had peace and security included in sustainable development discussions from the beginning. Because we learned over time that whatever you do on sustainable development dimension, when you have a conflict that breaks up, your efforts go down the drain because there's a conflict that you have to deal with. So this is an enrichment of what we have, and the country framework should be based on that. And this is also an opportunity for the country level to become better coordinated, because part of the problem at country level, and this is across the board in every country, the different line ministries don't coordinate with each other. And with this within this new development agenda, if we have the 4 basic building blocks that cover all of the issues, not economy, society, environment, and peace and security, maybe it will give us additional incentives to talk to each other more at country level. Because if the different ministries are not talking to each other, then the rest of us get very mixed messages. And that leads to very confusing mandates sometimes.
John, can I intervene here?
Thank you very much. Can I ask to open this up to the other panelists?
This is Maria here. Just a minor point. I agree with what has been said, but
Thank you, Maria.
I would just bring the attention to the fact that there are at the moment multiple consultative and deliberative processes, quite complicated, and the mechanisms and the processes are very, very heavy. So we need to propose very pragmatic things for sorting out this very difficult process. Other ways, this very good consultative process, which is the aim is to make sure that we involve countries, we involve all stakeholders that are relevant for the process, we might end up finishing that this is too complicated and we are not able to reach consensus on very pragmatic way to move forward. So the process at country level has to be extremely clear and straightforward, and ensuring this multi-sectorial approach, I think, is fundamental. Otherwise, the countries will be involved on all the consultations on the thematic issues, and this might contribute to a certain chaos at country level instead of proposing something which is much more a country level approach and a good contribution to the process. A word of caution on that.
Thank you. Other panelists?
John, this is Bill Sontag. Is it appropriate for me to intervene here? Hi, Bill Sontag with the Office of International and Tribal Affairs at USCPA in Washington. Just a couple of points. I think, not to underestimate the difficulty, but it's clear that the successful Millennium Development Goals around human health aspects, the classical cardiopulmonary disease, clean drinking water, chemical exposure, some of those are clearly going to continue in whatever context, but it's the new or somewhat different types of measures and goals that I think need the exploration in the post-2015 context. And that includes looking at population health in urban areas, the connection of ecosystem services provisioning to human health, the connection between biodiversity and human health. And I think, again, the point that was made during the presentation about the development of appropriate indicators under Millennium Development Goal 7, under the Sustainable Development Goals, to get to some of these things that we know are major impacts and connect the environment with human health are a direction that ought to be explored in the consultations. I would note one final thing, and that is there are developing information systems, including the UNEP Live information system that's under development by the Division of Early Warning and Assessment that could be very helpful. And also just a final note, don't forget the possibility of using crowdsourced citizen participation for some of the identification of information on population and public health.
Good point. Thanks.
Thank you, Bill. Those are very interesting ideas. And I'll remind everybody, this is the start of the discussion, the first in a series of at least 3 webinars. So hopefully, as we go through and deepen the discussion, we'll be able to come back to some of these ideas and themes. Anybody else on the panel want to address this issue of country frameworks? Okay, let's go on. This next question is one that I'm going to ask each panelist to address very succinctly. I think it's a question that can be answered succinctly, and I'd like to get to one more question after it. So this question is, if you could choose, or if you were writing these Sustainable Development Goals post-2015, which one would you put at the top? What is your most important goal for post-2015? And let's start with our speakers. Dr. Serwadda, if you're on, and Zehra, and Dr. Booth, and Dr. Neira.
It's a very difficult question. It's a bit like somebody asking me, we use people therapy in treatment of HIV now, and somebody asked me, if you had to choose one important drug in this cocktail, which one would you choose? There isn't any single most important. The whole thing is so much interrelated. There are so many variables that are interrelated in order to produce the desired outcome. So it's very, very difficult to just pick one single most important thing that really is, is overrides the other. Is my simple question. But if you put me in the corner, I might, if you want to take off my arm, I might just hazard one. But I would say that you need to work on multiple fronts, unfortunately, in order to make an impact.
I think that's a very reasonable answer. Let's hear from the other panelists. And we had a refinement from the audience. If you do have a goal, please, if you try to add some indicators that you would add to that as well.
John, can I go in? Maria here.
Yes, please, Maria.
It's an extremely difficult and strategic question, but what we are doing in WHO is to explore the potential for using universal health coverage as a way to try to accommodate the wide range of health concerns that we are trying to, and the specific disease goals, AIDS, tuberculosis, malaria, NCDs mortality, which is becoming a major issue. So we are proposing this universal health coverage as an overarching goal and a way to accommodate it, but without forgetting the important part that health is also a very potential beneficiary of policies in other sectors, to transport, energy, urban planning, water and sanitation, and many others that health can be a very good indicator of progress on that. So I will combine these two ones, but if I have to propose one, it will be universal health coverage. Over.
Thank you very much, Maria.
Hello?
Other speakers?
This is Zehra. Can I come in?
Yes, go ahead.
In New York, we've been very, very careful not to mention specific goals because that is up to the member states of the UN. But given my institutional basis, I would want something on climate change. It's time we have a target on climate change. And for indicators, I would try to link it to the 4 pillars that are emerging now for the next development agenda framework. So there would be an indicator on how much the economy is greening and how much the society is learning to be green, and how much better management of natural resources is preventing conflict. So those would be my indicators. But not as a UNEP staff, but as a citizen of the world, I really would like to see a goal on inequality, because research is showing time and time again in the last 5 to 6 years that when you have a more equal society, a lot of the ills and problems from health to education to environment are possible to handle. When inequality grows, you get into this very negative cycle that feeds into each other. So as a personal thing, I would want to see a goal on inequality. I don't know what the indicators would be, but perhaps the gap between different economic layers of society, access to social services, all of it will be measured in terms of the gap between who have access and who don't have. Anyway, that's my suggestion.
Thank you very much, Zehra. Great ideas. And just for the audience, our planning committee is discussing the idea of going into more depth on the issue of equality, justice, inequality in our 3rd webinar. So I think we'll be coming back to that theme. Dr. Booth, if you're on the line, did you want to add a comment? Okay. I asked him because we received a text comment from Dr. Booth. I wasn't sure if he wanted to deliver it in person, but he is making the point, and I think that Maria would agree with this, that as we discuss this idea of a post-2015 SDG on universal health coverage, that we ensure that the definition is broad and it goes beyond coverage in terms of the provision of clinical health services to a more comprehensive idea of universal health systems, which would incorporate public health more broadly and preventive services and the kind of intersectoral things that we're talking about, and to have that be part of this goal and set of indicators on universal health coverage. So other comments from our panelists or other speakers on the post-2015
John, this is Bill Sontag again. Goal. My point would simply be a very strong connection in whatever indicators are chosen to urban sustainability and the urban sustainability agenda as extremely important. Thank you.
Thank you, Bill. Other panelists? We have a comment from Dr. Wasserheit. I don't know if she is able to voice it herself. Okay, I'll just read it. She's making the point. Okay, I'm just trying to understand it. She writes that most of the non-health sectors have been oblivious to the MDGs. But with the launch of the Sustainable Development Goals, we have an opportunity and an urgent need to bridge across the sectors in a much more substantive way. And so the question is, how will the call for papers and or the other components of the post-2015 process that we've been talking about be structured in order to build this intersectoral linkage from the foundation up? So I guess that's really more of a new question than a comment coming in from our panelists. And I guess I'll say in the last few minutes, maybe we can bring that back to Zehra and Dr. Neira to give their thoughts on how this structure that we've laid out, as Dr. Neira pointed out, very complicated. is there a way in which we can avoid perpetuation of the silos and try to build in this linkage from the bottom up?
Should I go first? Okay.
Absolutely. Whoever wants to take it first.
I think we've learned a lot of lessons over the experiment of MDGs, let's call it. If we keep those lessons in mind, I think we will do better with the next development agenda. One of the lessons we have learned, not because of MDGs, but because of another process at the UN, which is the UN coherence at country level, has the potential to make sure that at least on the UN side, at country level, we will not work in silos. Because in we are piloting what we call one UN approach at the country level. And now there are 8 pilot countries, the official pilots, and nearly 30 other countries who voluntarily decided to go for this one UN approach of working together as one rather than in separate agencies at country level. That has shown us very good lessons, and we have seen how we can benefit more by working together more. Rather than lose, because when you work with other people, you have to give in a little bit, and there has to be give and take. And we learned that this give and take leads to better results for all of us. So it's a win-win approach. And if we can apply the lessons from the One UN process to the new development agenda, at least at the country level, I think there will be more coherence and therefore fewer possibilities for a siloed approach. And maybe some of that will also carry over to the headquarters level for UN and other international organizations, because all of the lessons of the last several decades is that the more you connect, the more you collaborate, the better the results are. This is perhaps a simplistic answer, but that's my answer.
Thank you very much. As we're running out of time, I wanted to, first of all, just bring in a comment that we received from one of our panelists who actually is not on the phone, and that was Fatoumata Ketuane, who was responding to the last question about if you could pick one. If there was one SDG that you would prioritize the highest, what would you pick? And while she acknowledged the difficulty of picking one, she also wanted to add to the conversation by pointing to universal education as an SDG that has many ramifications for the other kinds of things that we're talking about. She said that universal education is a solid contributor and vehicle of knowledge to support many other goals. So I just wanted to allow her to contribute in that way. Dr. Neira, did you want to address this other question that we had added, and after that we will be able to adjourn the webinar?
It's a difficult question, and I'm not sure that the papers are the ones that will force us to work on this intersectoral collaboration. But it's clear that if we fix some indicators under each of the thematic issues, and then those indicators measure how much we are collaborating intersectorally, this might be a way to create a mechanism that will force somehow this intersectoral collaboration and this avoiding these silos type. So I am confident on the indicators as a way to propose a more interactive and intersectorial linkages between the different goals or sectors that will be relevant for the process.
Thank you very much, Dr. Rea. I agree with that, and as we mentioned at the start, that was an effort that we tried to start to feed, and I would just point people back to the link that we had to the World Health Organization site on the green economy, where we had those discussion papers on indicators for other sectors that brought in the health content to just inform people and to support that last point that you're making. So at this point we've come to our 12:30 hour. I'd like to start by thanking our panelists and our speakers for really excellent presentations and an excellent start to this discussion. I think there was a lot of richness there, and as we go back and look at those again, we'll see that we really did cover a lot of ground and lay a foundation for future discussion. I'd like to thank our panelists as well for joining. All of us have been dealing with kind of the technical bumps of getting one of these going the first time, and so thank, first of all, the speakers and panelists for going through that, and then of course you, the audience, for sticking with us through that. We have received additional questions and additional comments. The beauty of this is that this is not a one-off. We will be here again in 1 month, the fourth Thursday on November 15th, same time, same place more or less. And so we'll have new presentations, but we'll also, I think, have an opportunity to try to bring up some of the questions that we have that we were not able to get to today. So with that, let me say a final thank you to the audience. Hope to see you again on November 15th, and we'll close this webinar.